Hi guys, today we're going to talk about setting up the IPV therapy in line with the ventilator setup. And for this purpose, we're going to use the regular standard IPV setup, not your cone-shaped setup, which we could use as well. But I just wanted to go over this setup first. And I just added some corrugated tubing here. Okay, so we're going to be setting that up on the Hamilton G5. And the first thing you want to do with the ventilator is you want to use a T-piece with a one-way valve here. Okay, and that's going to go on your inspiratory limb. And the reason why you want to use a one-way valve is so that you can actually leave this in line, so when you're not using your IPV, you can keep this on the vent, and it's like your typical nebulizer setup with the pressure valve engaged. So I'm going to put that in line. Okay, just like that. And you know it's on the inspiratory limb because you have your heater wire there, heater circuit. Okay, so that's on. And we have our IPV set up here. All your color coordinated tubing minus your manual remote button, which we don't need because this is going to be continuous. And the first thing we want to do before we set this up is go into our settings, and we want to change our sensitivity from flow trigger either to pressure or just turn it off so you're disengaging it. And the reason why we do that is because IPV is adding pressure, it's adding flow, and what that's going to do to your vent is send the signal, and so it's going to want to auto cycle breaths, and we don't want it to do that because we're doing this on purpose. And the second thing you want to do is make sure that you do oral care really well and do your subglottal suctioning, because what I like to do with IPV therapy on the vent is actually slightly deflate the cuff, and I'm going to show you that as well as I start the therapy. Okay, so this is where I'm going to set the IPV. Take my corrugated tubing here, that's going to connect to my one-way valve, and we're going to start our therapy. And when we start our therapy, we want to start it low. We want to start it probably about 20 to 30 to see how the patient tolerates it. We want to set our percussion here between easy and hard. I like to start off right in the middle, and then we can adjust accordingly. And then once your therapy is started, I'm going to come over here, and I have my fake lung connected to my ET tube. And like I said before, I want to get a small leak, small audible leak, so that way some of the secretions that are coming up can work themselves around the cuff, and I can suction the patient's mouth, so I'm going to do that. And as you look at the waveforms on this side, on your vent, you can see you're getting your rate, you're getting your tidal volumes, and you're getting your percussions from the IPV. Now you will have added volumes, you will have added pressure during this because of the IPV therapy, but that's supposed to happen. We have our small leak. I'm going to hold this, but as your patient tolerates it, the second treatment, the third treatment, subsequent treatments, you can actually go up on your pressure. And you can see right over here between 30 and 40, that's your ideal pressure. As long as the patient tolerates it, we actually want to increase that to be in the window. And then we also want to fluctuate between hard and easy, because what that does is it loosens up the secretions. As we go to hard, it gives harder percussions, but they're slower. That really works up a lot of the lower airway secretions. And then we can go in between the two. We can go back to our easy setting. It's a little faster, but it's actually lighter in pressure. Okay. Now what you're also doing at this time is you're suctioning the patient. You can suction through the ET tube, see if there's any secretions that are coming up from the lower airways. You can also suction the back of the mouth. A lot of secretion should be coming up through, up around the cuff area. As you're monitoring your patient, you're monitoring their vital signs, you're assessing the patient. And when you're ready to terminate the therapy, we want to go backwards. And what we're going to do first is we're going to inflate the cup. Okay, we have our cup inflated. We can now shut off our IPV. Make sure patient's fine. Come back to your vent circuit. Now you can disconnect your corrugated tubing from your one-way valve. And you can keep that in line. You can set your IPV setup in a bag, or if you have the cup holder, you can set it on the cup holder for the next therapy. So everything else, gone backwards, everything else we've done except change your flow sensor back. So we're going to put it back to whatever we had before. Flow trigger of 5 is what we had as a default. We're going to set everything back the way it was. And that's pretty much how to set up the IPV inline on your ventilator circuit. Thanks.